A note to doctors in Canada, if you're getting ready to leave because of the tax changes the Liberals made in the recent budget, don't worry. The Liberals have a plan to replace you with foreign trained doctors. Hello, I'm Adrienne Batra. With me are Brian Lilley and Warren Kinsella. So, the capital gains tax changes that the Liberals recently made in their federal budget, Brian, has a lot of people concerned for good reason, not the least of which are family doctors, medical doctors in Canada. We already have a shortage. We already have a challenge getting enough trained. We already have Canadians, millions of Canadians that can't get a family doctor. But the Minister of Small Business for Canada, Recky Valdez, has decided to say, Brian, that it's okay. You can leave. We
It,
got a plan to replace you.
it was shocking to watch, and it's also shocking. This happened on CBC a week ago, and then the clip started spreading around online with a lot of commentary, including from the Ontario Medical Association being critical of the minister. I believe the Canadian Medical Association has made comments about the issue as well, if not the minister in her comments directly. But what happened was David Cochrane from CBC was just asking the minister, well, are you concerned that these tax changes are going to result in doctors leaving the practice, leaving the country? These are very real issues. Doctors save for their retirement inside their corporation, that they run a private corporation as their medical practice. The best way for them to save for the retirement for years has been to save inside of that vehicle. And then they either sell their practice and retire from that, or they've saved up investments inside that vehicle, and then they sell off the investments to pay for their retirement. They're going to take a massive tax hit with these changes. And so Cochrane says, are you worried about them leaving? And no word of a lie, she said, well, we'll replace them with foreign trained doctors. We already have a shortage. We can't get enough foreign trained doctors to fill the gap we have now, never mind chasing people away who, think about it this way, Adrienne. It's not just established doctors, it's ones that are graduating who, quite honestly, will get offers from places like Texas and North Carolina. Come set
Mm-hmm.
up here. We'll pay off your school
Yeah.
loans. They get very generous offers to go elsewhere. They want to stay here, and our government's chasing them away and saying, but we'll get them from another country.
Warren, we have crowned Melanie Joly, the foreign affairs minister, probably the worst cabinet minister in the history of this country. Could this Recky Valdez take that crown away from Jolie with the absurdity of her comments?
Yeah, she's a contender. But like, I couldn't pick her out of a police lineup. And you pay me to pay attention to politics. And I don't think most Canadians could either. She's one of the ones who was jammed in the last shuffle in seats that they were worried about. And this demonstrates that, really at this point in their mandate, after 8 years, it's the C team. It's people with very little experience, very little sense of how to do a political job, how to be a minister. And here's some evidence of that. Like, we've had a problem with the loss of physicians and nurses in this country for about 20 years. Big part of the problem has been, and full disclosure, I represented the CMA many years ago. They told me that what was happening is you were having these young people graduating from medical school and nursing school, and we subsidized those schools through our taxes, and they were graduating with $250,000 in student loan debt. And so American hospitals and institutions were coming up here and saying, we'll pay off your entire student debt. We'll give you a signing bonus. Come on down to Dallas, come on down to New Orleans or whatever. And they've been doing that. So basically, in effect, what we've been doing is subsidizing physicians and nurses to go to the United States. So the problem was already a big problem. This just adds to it. And I think the Liberals' calculation was, well, everybody sees doctors as rich. Well, doctors aren't always rich. My dad was a doctor. I can tell you, he was not rich. Like they're preoccupied with, healing and saving lives. And, this one is yet another example of a policy blowing up in their face, because it's this capital gains change doesn't just hit doctors, it hits lawyers, it hits tech people, it hits your grandparents who've had their family cabin where for 30 or 40 years, all of those people are going to get hit by this thing. And this budget, if it stands for anything, it's the war on profit budget.
Brian, we already have a crisis in healthcare. We have long wait times. We have hallway medicine all across this country. We already have doctors and nurses, any of our medical professionals working endless and tireless hours. But yet, on the other hand, we still have almost over 2 million Canadians cannot get a family physician. They can't get in to see a doctor. They wait a long time to get a hip or knee replacement. There is such a challenge already, such a strain on the system. How do the Liberals think that this idea is the right move? And do you believe, after all the outrage that is coming their way, they might reverse course on this?
I don't, because this is what they see as their ticket back to support from voters. I mean, the polls don't back that up, but that's what they see. They've been fighting a battle on the carbon tax and they've been losing. And so part of why they created this was not done for great economic benefit. It was done to try and create voter benefit, political benefit for Trudeau. He wants to campaign on capital gains tax instead of the carbon tax. He's lost on the carbon tax, but he thinks he can turn around and say, you know what, we're for fairness. We're going to make the rich pay their fair share. And if you oppose this capital gains tax, you're for the super wealthy. They're not framing it as the 1%. They're framing it as the 0.13%, which is an outright lie. And it's shameful that the Federal Civil Service allowed that to go in the budget. That's a political statement, not a reality-based one. And it's not just going to hit doctors, as Warren said. Sure, we're trying to encourage more doctors to set up shop here, but Justin Trudeau also wants small-time landlords. He doesn't want what they call the financialization of real estate. They want mom and pop to buy a building down the street, a 4 or 5 apartment block. They want them to buy a second home and rent it out. They want small landlords. This discourages that. Why would you invest if you're going to be hit with a huge capital gains loss? So on everything that they say they're trying to accomplish, this budget goes in the opposite direction.
Warren, last word to you. I mean, the last person that the last group of people that you may want to pick a fight with are doctors. They're organized, they're vocal, they have a lot of sympathy from millions of Canadians, from their patients, because their family doctor is there's such a great relationship there. And so I'm wondering, from your perspective, is this one of those ones that the Liberals completely, well, it would appear they miscalculated it, because saying what Brian is suggesting that they're trying to do with this capital gains, oh, it's about the rich paying more. I don't think that that's going to fly.
No, I don't think so either. I mean, it's, as Brian says, it's a bit of a class warfare stunt. And the Trudeau guys have become notable for that. But, they really need to look closer at their research. The dominant issue in federal politics most of the time, right now, it's, cost of living and your pocketbook issues. But most of the time in this country, for decades, it's been healthcare. And the proponent for healthcare that's considered most credible and most respected is physicians and nurses. Like, they are the face of healthcare. And when you go after them, you need to have a really good reason for doing so. When you start to shrink the number of them in communities that are already starving for medical care and medical professionals, you better have a really good rationale for doing so. And they don't. Instead, they put out this C-team minister who doesn't know her you-know-what from her you-know-what, saying something that is completely outrageous. So we're going to see more doctors and nurses leaving this country and heading to the United States. I'm hearing from people like that. So are you guys. I know that they've just had it. They're fed up.
Well, let us know what you think in the comments below. Like this video and subscribe to our YouTube channel, and go to the TorontoSun.com. You're going to find commentary and coverage there you will not find anywhere else.